Hi, I'm Bill MacPhee. Welcome to today's Mental Health Recovery blog with Bill MacPhee. Today we're going to talk about depression, but before we get into that, I just want to update you a little bit. On this weekly blog, today is Friday, April the 10th, 2015, and today we're going to talk about depression. But before we go on and talk about depression, I just want to give you a little background of what we're doing here. I'm doing a weekly blog based on the Bright Future program. And the Bright Future program is based on recovery. And my definition of recovery is when you wouldn't want to be anybody else but who you are today. So this recovery basically is, I've created a program called the Bright Future program, and I'm talking about this on this regular blog. However, though, if you do have questions for me and you'd like to ask me a question regarding on anything regarding recovery, feel free, or specifically on the DVDs that we're doing or these videos that we're doing, feel free to do that. So, in saying that, again, my definition of recovery is when you wouldn't want to be anybody else but who you are today. And we talked about understanding. We're in the section of understanding your illnesses, and today we're talking about depression. Depression is very, very serious illness. Depression is when we have a feeling of a loss of hope, loss of self-worth, lack of self-esteem, a lack of confidence. We have a lack of joy. We have a blunted, flat, dark feeling all the time. Depression is a very, very serious illness, and a lot of people are depressed. They say that by the year 2020, depression will be the second largest disability next to heart disease and stroke. So it's widespread. Depression, you have basically you can have depression caused from triggering of, say, a divorce or a situational depression, which can be, say, caused by a trauma in your life, whether it be a divorce or death in the family, a loss of job, financial despair. These things could be possible triggers. However, there is also chronic depression where you can go back in somebody's life or you can talk about their present situation and there may be no reason for them to have depression, but yet depression comes. And that's why we know that depression is biological as well. It's a chemical imbalance or kind of a mood disorder, and that's what it's like. Depression, though, can be very, very dangerous. Now, depression is actually, if you left it long enough without seeking help, depression would eventually go away. However, the fact that depression is so dangerous because it gives us thoughts of suicide, thoughts of harming ourselves and everything, that we can't take the risk and wait for it to go away by itself. That's why we need treatment. In my case, I was hospitalized 6 different times. I lived in 3 different group homes. I had a suicide attempt. Even though my diagnosis was schizophrenia, depression came in my life, dealing with those negative symptoms of schizophrenia, and it was devastating. I actually had a suicide attempt. In fact, in my book that I wrote, To Cry a Dry Tear, Bill MacPhee's Journey of Hope and Recovery with Schizophrenia, I actually have a picture in that book of my suicide note that I wrote. So suicide is very, very common with depression. That's why we need to seek help. Now, we usually with depression, you'll be put on antidepressants. I was put on antidepressants, but it's very important to recognize and understand that you're depressed. Now, in saying that all about depression, it's very important that we get treatment, we see a doctor, we inform people, we bring as many people in our world to help us out socially as possible, because depression is very, very dangerous. Now, I just want to tell you that there's sort of like what we have SAD as well, the seasonal affective disorder, or sometimes people get the blues. Those things are different. Everybody gets down once in a while. Everybody gets the blues. But when it comes to actual biochemical and depression, very deep depression, chronic depression, it's very, very serious. So seek help. That's number one. Seek help. So we have situational depression. We have depression, chronic depression that can just show up out of the blue. And what we need to do about it, well, stay around and continue to watch these series, these videos. And next week we're going to talk about obsessive compulsive disorder. And then after that we're going to get into stress. And then after that we're going to start the first pillar of recovery. After that, so tell people about this channel. If you have a question for me, you can email me at bill at billmcphee.ca, and MacPhee is MacPhee. Feel free to send the question. As well, check out that website and our other website, which is mentalwellnesstoday.com, and you can sign up for regular newsletters from me as well. So have a great day. Remember that recovery is when you don't want to be anybody else but who you are today. And remember that there is life after mental illness. And again, remember, there is always a way. Have a great day.